Frank worked as a certified athletic trainer and emergency medical technician for more than 15 years. He visited the doctor in February of 2007 for his yearly physical. He was advised to lose weight and exercise more, so he started jogging and lifting weights. Within a few months, he was running up to 2 miles at a time and shedding pounds. But in June 2007, he felt a sudden numbness in his arm and experienced hearing loss while driving. He thought that because he was only 42, he couldn't be having a stroke. That was a true story about Frank Manstraglo of Shirley, Massachusetts, and for the next few minutes I will provide you with information about cerebrovascular accidents or strokes. First, I will tell you what a cerebrovascular accident is, the various types, what causes it, and how it is diagnosed. Next, I will outline what someone who is having a stroke looks and acts like. Finally, I will tell you about treatments that are available for people who are experiencing a CVA. I will begin by explaining what a CVA is, what causes it, and how it is diagnosed. A cerebrovascular accident, CVA, or stroke is any disease process that interrupts vascular blood flow to a distinct region of the brain. A CVA occurs when a blood clot blocks an artery or blood vessel breaks, interrupting blood flow to an area of the brain. When either of these things happen, brain cells begin to die and brain damage occurs. According to the National Stroke Association, 795,000 Americans suffer from strokes each year. It is the leading cause of death in the United States. In addition, the National Stroke Association estimates that 80% of all strokes are preventable through risk factor management. There are two types of strokes. According to the American Stroke Association, the first type, an ischemic stroke, is caused by a clot obstructing the flow to the blood in the brain. The second type, a hemorrhagic stroke, is caused by a blood vessel rupturing and preventing blood flow to the brain. Ischemic strokes are more common than hemorrhagic strokes, and hemorrhagic strokes account for 13% of all strokes, yet are responsible for more than 50% of all stroke deaths. Strokes can happen to anyone at any time, regardless of race, sex, or age, but researchers have noticed certain risk factors that can precipitate strokes. Approximately 55,000 more women than men have strokes each year. African Americans have almost twice the risk factor of first ever strokes compared to whites. The chances of having a stroke approximately doubles for each decade of life after 55. Certain medical conditions are known to be risk factors for strokes. High blood pressure is the leading cause of stroke and the most important controllable risk factor for stroke. Many people believe the effective treatment of high blood pressure is a key reason for the accelerated decline in the death rates for strokes. In addition, diabetes is an independent risk factor for strokes. Many people with diabetes also have high blood pressure, high blood cholesterol, and are overweight. This increases their risk even more. While diabetes is treatable, the presence of the disease still increases your risk for stroke. The National Stroke Association also identifies lifestyle stroke risk factors. These risk factors include smoking, being overweight, drinking too much alcohol. You can control these risk factors by quitting smoking, exercising regularly, watching what and how much you eat, and limiting alcohol consumption. A stroke is diagnosed through several techniques. Physicians are usually able to make a diagnosis of stroke after a thorough neurological exam. The diagnosis of stroke itself is clinical with the assistance from imaging techniques. Imaging techniques also assist in determining the subtypes and causes of strokes. Primarily, CT scans with and without contrast and MRI scans are used. In addition, Doppler ultrasound, arteriography, and electrocardiography are also helped in diagnosing strokes. A stroke is a true medical emergency. It can come on suddenly and at any time. Early action can minimize brain damage and potential complications. Therefore, prompt treatment is crucial. It is important to be able to recognize the signs and to get immediate medical attention. The American Stroke Association outlines many common signs and symptoms of stroke. The American Stroke Association has developed an acronym to help remember the signs and symptoms of a stroke. FAST, FAST, is an easy way to remember the sudden signs of a stroke. When you can spot these signs, you'll know you need to call for help right away. F. Face. Unilateral or one-sided facial drooping. An easy way to test this facial drooping is to smile. If one side of the smile raises normally and the other side does not move, this person is positive for facial drooping. Arm. One arm may present with weakness, numbness, or tingling. In addition, there may be an arm drift. To test the arm drift in a possible stroke patient, the developers of the Cincinnati Stroke Scale recommend having the person close his or her eyes and hold their arm straight out in front of them for about 10 seconds. If one arm moves or winds up drifting down more than the other, it could be signs of a stroke. Speech. Speech is a common symptom of a stroke. The speech of a person who is experiencing a stroke may be slurred, hard to understand, or they may not have any speech at all. To test a positive stroke patient's speech, ask the person to repeat a simple sentence like, "The sky is blue." If the person is unable to repeat the sentence in his or her normal speech pattern, they may be having a stroke. T. Time. If someone shows any of these symptoms, even if these symptoms go away, call 911. Get the person to a hospital immediately. Check the time so you'll know when the first symptoms appeared. In addition to the symptoms defined by the American Heart Association's FAST acronym, there are also signs that a person could be experiencing a stroke. Other symptoms include sudden numbness or weakness of the leg, sudden confusion or trouble understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, or loss of balance, sudden severe headache with no known cause. Now that you know what a stroke is and what it looks like, I'll explain how the different types of strokes are treated and what the prognosis is for people diagnosed with a stroke. Although strokes cannot completely be prevented or cured, early recognition and treatment can improve function and quality of life. According to the National Institute of Health, treatment for a stroke depends on whether it is ischemic or hemorrhagic. In addition to the type, treatment depends on the cause, how much time has passed since the symptoms began, and whether you have other medical conditions. Treatment focuses on restoring blood flow for an ischemic stroke or controlling bleeding for a hemorrhagic stroke. Ischemic strokes are caused by a clot obstructing the flow to the brain. Therefore, treatment would include breaking down the clot. Recently, there has been a medicine approved by the FDA that can break down a clot that is occluding brain blood flow. According to the National Stroke Association, thrombolytic drugs help reestablish blood flow to the brain by dissolving the clots, which are blocking the blood flow. In June of 1996, the clot buster, Activase, became the first acute ischemic stroke treatment to be approved by the FDA. Activase is also known as a tissue plasminogen activator, TPA. To be effective, thrombolytic therapy should be given as quickly as possible. TPA should be given within 3 hours of symptom onset. It is important for people to understand stroke warning signs and to get to a hospital quickly in case they are eligible to receive TPA. Time is an important factor associated with determining whether a patient can receive this medication or not. Hemorrhagic strokes are caused by a blood vessel rupturing and preventing blood flow to the brain. Therefore, treatment would include controlling bleeding, reducing pressure in the brain, and stabilizing vital signs, especially blood pressure. Surgery may be needed to remove the blood that is built up inside the brain and to lower pressure inside of the head. Recovery after a stroke is often a lifelong process, and everyone is impacted by this event. The National Stroke Association explains that each part of the brain influences physical, cognitive, and emotional functioning. Effects can be experienced at varying degrees at any phase of recovery. Stroke is a trauma and it takes time to heal. After a stroke, survivors may need modifications to their home, assistive devices to help them obtain a steady gait, or even special accommodations to help them communicate. Life after a stroke is possible. The prognosis is not always grim. Many survivors are able to maintain a good quality of life after a stroke. For the past few minutes I have provided you with information about strokes or cerebrovascular accidents. I have explained the two types of strokes, ischemic and hemorrhagic. Then I have discussed the risk factors of stroke, such as high blood pressure and diabetes. Next, I have talked about the diagnostic tests, such as CT and MRI scans. I have explained the common signs and symptoms as well as the treatment modalities. Finally, I have concluded that although a stroke cannot completely be prevented or cured, early recognition and treatment can improve function and quality of life.